Amendment by Busey.
Chair recognizes Mr. Busey to explain the amendment.
Thank you, Mr. Speaker and members. Sometimes the most urgent truths are not the ones spoken in statistics, but the ones felt in the silence between breaths. It's the father in Alpine working 2 jobs and praying his child's fever breaks because they can't afford a trip to the emergency room. It's the mother in the Rio Grande Valley who rationed her insulin for months and never told her kids how close she came to losing her life. It's the young man in East Austin who skipped a cancer screening because the bill cost more than his paycheck. It's the woman in rural Texas who gave birth alone, uninsured and hemorrhaging because her local hospital had shut down. These are not rare stories. These are Texas stories. They're all of our stories. And it should break all of our hearts that one of the richest states in the richest country on earth has allowed this to become our normal. For far too long, this body has accepted the unacceptable. Nearly 5 million uninsured Texans, the highest uninsured rate in the nation, billions in federal funds left on the table, and a rising human toll of our inaction. Mr. Speaker, members, today I bring forward an amendment to expand Medicaid in the state of Texas. This amendment would direct the Health and Human Services Commission to prepare and seek a waiver to expand Medicaid to the fullest extent allowed by federal law, to finally bring home the federal dollars we are already paying into the system, to finally cover over 1 million of our uninsured neighbors, and to finally take action to save lives, strengthen our economy, and uplift our communities. Expanding Medicaid would provide coverage to 1.2 million Texans who are currently uninsured. These are working Texans. They work in construction, in restaurants, in child care centers, in agriculture, and in offices across this state. They are the people who keep this great state running. With Medicaid expansion, Texas would see an estimated $704 million in savings every single year. We'd see a creation of over 230,000 new jobs. We would bring home $110 billion in federal dollars to our state economy over the next decade, all while lowering health insurance premiums costs for each and every one of us. We would also relieve our hospitals of the staggering burden of $7 billion annually in uncompensated care. Right now, that cost is shouldered by our local hospitals and Texas taxpayers in the form of higher premiums and, yes, higher property taxes. With Medicaid expansion, we can ease that burden and redirect that money to where it's needed most. And for rural Texas, Medicaid expansion would be a lifeline. Since 2010, 26 rural hospitals in Texas have closed. Another 76 are at risk of closure. When those hospitals go dark, it's not just healthcare that disappears. It's jobs, it's emergency care, it's babies being born 60 miles from their home. It's a community losing its heart. Medicaid expansion would help keep those hospitals open. It would provide reimbursements for the care they already provide. It would ensure that rural Texans don't have to choose between their health and their hometowns. And it doesn't stop there. Right now, 1 in 4 Texas women of reproductive age are uninsured. That is why our state has one of the worst maternal mortality rates in the country. Medicaid expansion would ensure more Texas women get consistent, preventative, and postnatal care, and more babies get to grow up with their mothers. In short, Medicaid expansion is pro-life. So let's be clear. 73% of Texans support Medicaid expansion. This isn't a partisan issue. It's a Texas issue. Conservative states like Arkansas, Utah, Ohio, even Louisiana have expanded Medicaid. They brought their tax dollars home, they've invested in their people, and their people are better off because of it. Meanwhile, our Texans, Texas taxpayers, are still paying into the system. Every paycheck, every tax season, and getting nothing in return. Our money is going to expand coverage in other states while Texans are left behind. That should outrage each and every one of you sitting in your desks right now. Members, I have filed this bill every session to expand Medicaid. Each time the facts have been clear, each time the public has supported it, and each time the consequences of inaction have grown worse. But today we have a choice, and we can act tonight. We can choose compassion, we can choose life, we can choose common sense. We can choose to make Texas a place where your zip code doesn't determine whether you live or die, where no one has to skip a doctor's visit to pay the light bill, where hospitals stay open, babies are born safely, Texans get the support they need, and parents sleep easier at night knowing that they will be able to care for their children. Look, Medicaid expansion, it's not about Republicans versus Democrats. This is about right versus wrong, and it's time that we get this right. In a nutshell, this amendment is simple. It saves money and it saves lives. We have a coverage gap, but more importantly, members, we have had a courage gap. That is the real problem that we face.
Mr. Turner, for what purpose?
Mr. Speaker, with the gentleman yield for some questions.
Gentleman yield for questions?
Just one more minute, sir. So I ask
Not
you,
at this time.
not as a legislator and as your friend, but as a father, as a neighbor, as a Texan, let us rise to meet this moment. Let us open the door to care. Let us give hope to those who have waited for far too long. Let's help that father in Lubbock working the 2 jobs, the mother in the Valley who rations her insulin, the young man in East Austin who skipped his cancer screening, the woman in rural Texas who gave birth alone. Let's turn the page in this state so these are no longer our stories. And let us long last bring our Texas tax dollars home.
Mr. Turner, for what purpose?
Mr. Speaker, with the gentleman yield for questions.
Gentleman yield for questions?
Yes, sir.
Gentleman yields.
Thank you, Representative Busey. You know, like you and I think a lot of our colleagues, I hear a lot about the rising cost of insurance from my constituents. Can you talk a little bit about how Medicaid expansion helps address the healthcare affordability crisis we have in the state who already have insurance?
I think one of the key reasons for why it benefits all of us, we talk a lot about the 1.2 million roughly Texans that would benefit, but I said it would help all of us, and this is why. When we have to pay for uncompensated care at the hospitals, our local taxes go up, and insurance will then pick up the other costs by spreading it on to people that have coverage. So more people with coverage, the more the cost can go down.
So, and I've heard in the past, I'm wondering if you have heard this as well, that for people with health insurance, 1/3 of our premiums basically subsidize the cost of uncompensated care in the state of Texas. Does that sound about right?
That is right. And why this is so important, Representative, is we got 5 million uninsured Texans. This won't solve all of that, but this will solve around 1.2 million working Texans making below the 138% of poverty line. That's roughly $21,000 income for a single person. We're talking about $21,000, people that are working in our community, but they can't afford the health coverage. That's why the Affordable Care Act was passed by Congress with the Medicaid expansion preview to do this right here, to cover working Texans, but they just don't have enough to go get the health insurance.
Absolutely. And it's my understanding that studies I've seen, if we expand Medicaid in the state of Texas, it'll mean over $700 million in annual savings to our state budget, create over 230,000 jobs through the economic multiplier effect, and bring $110 billion of our federal tax dollars back home to Texas. Isn't that right?
That's absolutely correct. This is a money savings across the board. We've talked about by the cost on hospitals, especially rural hospitals, having to do uncompensated care. We talked about how it can lower the cost for all those with insurance. But also, we got to think about the preventative health care costs. When you have insurance, and I've had conversations with my colleagues that disagree with this, that will talk about insurance doesn't equal care. But we know that insurance dramatically increases wellness checks and preventative health care. So while it doesn't mean 100%, if I have insurance, I am significantly more likely to go. Like from 30% to 70%. In kids, it's from 50% to 80%. We're significantly more likely to go get those wellness checks. We're all working on preventative health care and healthy lifestyle this session. This is a way to do that. And I think one more thing that's really imperative here, because we're going to hear people talk about what the costs, that it's a 10% match. Yes, the federal government is going to pay 90%. We pay 10%. And this bill was given a hearing. LBB talked about it. It was a long time ago. We've been fighting this fight for a long time. And when LBB, the last time they did a fiscal note on Medicaid expansion, they said net positive fiscal impact to the state, as well as significant savings in terms of local impact. So it will save all of us money through the many reasons we talked about. But we talk about our property taxes being high, our county taxes being high. This is a silver bullet with helping that. And I know our colleagues across the aisle have talked about lowering taxes. Let's do it right now. We can do it with this vote.
The gentleman's time has expired.
Mr. Speaker,